Yes, sir. Thank you, sir. You can start now.
All right, sir. Just give me 1 second.
But before that, I request all to mute your mic, please. Everyone take precaution. Mute your mic, except speaker.
Should we start?
Yes, sir.
Have you on the video? Have you on the YouTube video?
Yeah, already.
All right, sir. All right. Dear Dr. Deshmukh, hello everybody. We have a very important discussion on monkeypox, which is a current threat to this world. I welcome Dr. Deshmukh, President of MBSI, Dr. Haris Khan, Head of Microbiology and Medical Superintendent, Medical College, Aligarh Muslim University, Dr. Hiba Sami, he is Assistant Professor in the same Department of Microbiology. I welcome Dr. Miranda Datta, who is now in the Jorhat Medical College, Dr. Akam Fushi from Nagaland, he is in the Zion Hospital, Dimapur, and Dr. Elim Marak from Meghalaya. He's working in Tura in Meghalaya. All these doctors, medicos, they're not PhD, but they are MDs and MS, all of them. So we'll have a very good interaction about prevention of monkeypox, what are the remedies, how to be safe, and the virology of monkeypox. I now call upon Professor Haris Manzoor Khan to initiate the discussion on monkeypox, which is a threat to society. Dr. Haris Khan.
Good afternoon, everyone. And first of all, I would like to thank Dr. Deshmukh and Dr. Soranjit for inviting me to this meeting on a very relevant topic today, which is of very big concern to everyone in the health sector. This particular topic, the monkeypox, I think probably all of us are still learning about it. We are not sure about what will be the outcome of this, because I remember the COVID episodes. In the initial part, all of us we had very little knowledge about COVID. And then subsequently, we have had a good exposure. Now we know what is COVID and how to manage it. But this monkeypox, again, is something which all of us are not very well aware of. Every day, we keep hearing about new things about monkeypox. And till late night yesterday, there were 8 cases. But like what I've been reading in the papers and literature, that this may be just a tip of the iceberg. I just hope I'm wrong, because we cannot afford to have another episode of any infectious disease in India. Because what we have been learning about this is, in majority of the cases, it's basically in the bisexual and gay group. So there is a typical social stigma attached to it. So many people may not like to come forward to the doctors or to the hospitals to get this examined. So at the end of it, you may have a large number of people harboring this disease, but we are not able to locate them. And as a result of which, the spread may become too much of an outburst, and then things may become difficult. as a microbiologist, what the government has given several guidelines, and the international bodies also have given different guidelines. But what I've been reading, and I've discussed this in my department also, today also and before, that even the collection of the specimen itself is quite a complicated process. It may not take less than 30 minutes. So if you have, say, even 20 to 30 patients from where you have to collect the specimen, that itself will be a big issue. And then the transport of these material to the diagnostic lab. For example, up to now, what we know is 15 centers have been identified to where we can send the samples, and that too using the cold chain and dry ice. Dry ice, I think all of us know that at least in UP, hardly there is any towns or cities where this dry ice is available. So even the transportation may become an issue. So I hope the things are under control, or if they are not under control, the centers will have to be increased so that the transport of the specimen may not become too difficult. I would like to, because I'm leaving the diagnostic part, Dr. Hiba Sami. She's a very efficient assistant professor. She has been looking after COVID through these years. She will be giving the more details of the diagnostic center. So I'd like to hand over to Dr. Saranjit, and thank you once again.
Thank you very much, Dr. Haris. I call upon Dr. Hiba now to present a fantastic presentation.
Thank you so much, sir. I thank you, Haris sir, and thank you all the organizers, Dr. Deshmukh and Dr. Swarnidhi sir, for making me a part of this. So before starting, let me share my slides. Do I have the rights to share the screen? Please give me rights to share my screen.
Yes, you can share. You can share. Hiba ma'am, you are post now. You can share the screen.
Okay. So please make the co-host to Dr. Hiba Sami one.
जो हैंडल होते हैं
Is there any problem in presentation?
Sir, I'm logged in by the name of Dr. Hiba Sami. That's my laptop.
Sharing the screen?
Yes, sir.
Yes.
I'm not able to share my screen.
Okay, okay. So another, Dr.
Hiba Sami.
Hiba Sami.
Hiba Sami. Okay, I will make. Yes, now you are co-host. You can share. Can you?
Yes, sir. I have,
Yes,
shared.
yes.
Can you
Thank
see
you.
my screen?
Yes, we can.
So we think we are done with the pandemic, but the pandemic is not done with us. So zoonotics seems to be in the news for one or another reason of late. So from coronavirus, bird flu, and now monkeypox virus. So the emergence of this virus in separate population around the world in location where it does not usually appear has alarmed scientists and sent them racing for answers. So here I am with the updates on the monkeypox diagnostics. So the pox virus are the largest and the most complex of all the viruses. So members of this family are morphologically similar and share a very common nucleoprotein antigens. So infection with most of these pox viruses is characterized by a rash. So the monkeypox is among one of the pox viruses. So it was discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. So despite being named monkeypox, the source of the disease remained unknown. However, it was then believed that African rodents and non-human primates like monkeys might harbor the virus and infect the people. So coming to the classification of this monkeypox virus, so it belongs to the genus Orthopox viruses, which also has other viruses, namely variola, the causative agent of smallpox, and vaccinia, which have the agent that is used in the vaccination. So the primary host were rodents and monkeys, and it causes generalized disease. So monkeypox is a part of the same family, but it causes milder form of illness than smallpox. So it has two clades, the West African clade and the Congo Basin clade. So the West African clade is less severe with less transmissibility and a low case fatality rate as compared to the other one, that is the Congo Basin one. So luckily this time the scientists are researching obviously, but till now the currently circulating strain has been the West African clade. That is the less severe one. So we can have a sight of relief that. Coming to the properties of pox viruses, so structure and composition is same to all the pox viruses, including the monkeypox. So they all have a brick-shaped structure, which has a core, lateral bodies, outer membrane, and an envelope. So we can see here the structure of the monkeypox virus or the pox virus. So the core that has a nucleoprotein that is maintained in a super helical configuration and appears to occur in a globular structure interconnected by DNA protein fibers, so resembling the nucleosome structures of eukaryotic chromatin. So it is an enveloped DNA virus and it is a zoonotic disease. So what we mean by zoonotic disease? Zoonotic diseases are those diseases which are spread from animals to humans. Okay, so prior to the 2022 outbreak, monkeypox has been reported in people in several Central and Western African countries only. So initial discovery was in a Danish laboratory in 1958. After that, the first human case was reported in a 9-year-old boy in the Democratic Republic of Congo in 1970. So according to CDC, as per the data of 2022, currently there are more than 23,000 cases all over the world. And monkeypox have been detected in various countries in which it was not detected earlier. There are 73 such countries in which the monkeypox virus does not existed earlier, and now the cases have been reported from these countries. So India confirmed its first monkeypox death on 1st of August. That was a patient from Kerala. So coming to the transmission, how this monkeypox is spread. So this monkeypox virus is a zoonotic disease. So first is spread from animals to human, and once the human get the disease, they can spread from it can spread from human to human through close contact or through the fluid that is coming out of the respiratory secretions or the different lesions that have. If the person come in contact with the lesion, then it can spread from person to person also. So animal to human transmission occur by the bite or a scratch of the infected animals. So the infected animals may be rodents like rats, squirrels, or they may be non-human primates like monkeys, apes. So once it is spread to human, the human to human can spread by direct contact with the monkeypox rash, scabs, or from bloody fluids from a person with monkeypox. It can also spread from mother to the fetus through placenta during delivery. So once a person gets the monkeypox, what are the symptoms? So fever, headache, muscle aches, and backache. Swollen lymph nodes, chills, exhaustion, respiratory symptoms may occur like sore throat, nasal congestion, or cough. So the rash is typical of that monkeypox. It goes through different stages, which I will tell you further. The rash will go through several stages and including scabs before healing. So it can look like pimples or blisters and may be painful or very itchy. So there are 4 different stages of the disease. The first stage is of incubation, that is of 5 to 21 days. There is no symptoms in this stage, and the virus may be present in the bloodstream at the end of this incubation period. The second stage is the febrile stage, in which the patient may have fever with other symptoms. The febrile stage lasts for 1 to 4 days. The other symptoms that may occur apart from fever are swollen lymph nodes, headache, chills, sore throat, malaise, and fever, fatigue. So the virus can be found in the blood at this stage, and we can make the diagnosis through blood sample at this stage. That is a stage 2. So small lesions in the mouth appears toward the end of this stage. So this stage is followed by the third stage, that is the rash stage. So the rash stage is characterized by the appearance of different rashes. So they can be macules starting from the face, spreading to the arms, leg, palm, and toe within 24 hours. So rash goes from macular, papular, vesicular, pustular phase, as we can see here in the picture. So the classical lesion is vesiculopustular, and the face involvement is seen in 98% of the cases. The disease progression in the third stage. So virus is present in the blood in the early stage of this third stage, and it is also present in the skin lesions. So at this stage, we can isolate the virus from the skin lesions. So antibodies are produced and become detectable. It is a rash illness. So the differential diagnoses are like chickenpox, disseminated herpes zoster, disseminated herpes simplex, secondary syphilis, hand, foot, and mouth disease, infectious mononucleosis, or molluscum contagiosum. So these all are rash illnesses from which it has to be differentiated. Last stage is the stage 4, that is the stage of recovery. The patient recovers and scars may remain. So at this time, the specific antibodies are present in the blood. So once we suspect a case from monkeypox, we need to diagnose or differentiate it from other common illnesses which are circulating in that area, like chickenpox and measles. So the main feature that differentiate monkeypox from other illnesses or other similar looking illnesses is the presence of lymphadenopathy, that is a swollen lymph node. So that is present in monkeypox, absent in chickenpox, and maybe occasionally present in measles. Coming to the laboratory diagnosis part. So the optimal diagnostic sample which we should take is the skin lesions, the roof or fluid from the vesicles and pustules can be taken, and dry crust. So if feasible, biopsy can also be taken. Lesion is swabbed vigorously to ensure adequate viral DNA is collected. So we have to take the sample from 2 different lesions from 2 different sites and which differ in appearance. So this is the guidelines of Ministry of Health and Family Welfare of India. They have given the guidelines. If the patient is asymptomatic, we have to observe for the development of any sign and symptoms for 21 days. If the signs and symptoms develop, we have to collect the samples and send it to the designated lab. So if the patient is symptomatic, we can, and the patient is in the rash phase, we can collect the lesion roof with scalpel or plastic scraper. We can collect the lesion fluid and keep it in the plain vial. Lesion crust in the plain tube. Apart from the lesions, we can collect the nasopharyngeal and oropharyngeal swab. One thing that has to be kept in mind is that nasopharyngeal and oropharyngeal swab has not to be put in the VTM. Just like in COVID-19, we have to transport in the viral transport medium. In this case, both the swabs, that the oropharyngeal and nasopharyngeal, has not to be kept in VTM or any other bacterial medium. So blood can be collected in the EDTA tube and also the SSGT tube, that is a clot activator tube, and urine has to be collected in the urine container. So these are the different samples which can be collected from the patient during the rash phase. If the patient present in the recovery phase, we can collect the blood samples in the clot activator vial or urine sample in the urine container and send it to the designated lab. One more guideline has been given by the Ministry of Health and Family Welfare that if we are suspecting a case of monkeypox, a clear lesion image should be sent along with a case record form. So they have provided a case record form Along with that, we have to send a clear picture of the lesion. So all the samples being transported should have triple packing, just like we have done in COVID-19, with proper labeling and documentation. So the specimen should be refrigerated or frozen within an hour of collection and transported to the laboratory as soon as possible. If we are suspecting any delay, we have to keep the sample as -20, or for more time is required to transport the sample, we have to keep the sample in -70 and over. So once the sample has been collected, we have to go for the test. What test we have to do? There's a polymerase chain reaction is a preferred laboratory test. So there are different PCR protocols, should include detection of the orthopox viruses, and more specifically the monkeypox viruses, with distinction of the Congo Basin and West African clades. So it is important to differentiate, to know the epidemiology of the disease, which clade is being spread, and what we can expect in the future. So the PCR for orthopox genus has to be done first. So it's the first PCR, which is the general PCR. And if it comes positive, then we have to go for the second PCR that is specific for the monkeypox. So additionally, virus isolation and the next-gen sequencing can be done for further characterization of the samples. One thing we have to keep in mind that all the waste that may contain monkeypox virus should be decontaminated before disposal by autoclaving or chemical disinfection. So this is the CDC guidelines on monkeypox testing. So CDC says that if we suspect a case for monkeypox, then we have to go for orthopox PCR, that is the general PCR for the whole genus of the orthopox. If it comes positive, then we have to consider it a probable case of monkeypox and isolate the patient and start the treatment. And the further characterization can be done at the CDC of that strain. So other methods apart from PCR that can be used for the diagnosis are electron microscopy and viral culture. But the viral culture is not recommended as a routine diagnostic procedure, and electron microscopy is not routinely used for the diagnosis of pox viruses. The most common method that we use for general all infections, that is the ELISA, as the antigen and antibody detection, do not provide monkeypox specific confirmation due to the serological cross-reactivity. So that's why it is not recommended for diagnosis. We have to go for the PCR, and ELISA should not be done. So we know that vaccination against smallpox was demonstrated through several observational studies that it was 85% effective in preventing monkeypox. Thus, prior smallpox vaccination may result in the milder illness. So there is a cross-reactivity. That's why ELISA cannot be used for the diagnosis of monkeypox. So if we suspect a case, or if we came across a case which shows signs and symptoms of monkeypox, what we have to do? So ICMR has designated these 15 viral research and diagnostic labs throughout the India. So this is a VRDL network of labs that is currently running in India, funded by DHR, ICMR. So they have identified these 15 labs throughout India, which we can contact if we suspect any case, and we can send the samples to them. So these labs have been trained, and they have been provided with different reagent and different kits for the diagnosis of monkeypox. This is the list of the labs that are designated for the diagnosis. So these are my references. So the World Health Organization, that is WHO, recently declared monkeypox a public health emergency of international concern. So, but we should not panic, as monkeypox does not transmit from person to person as readily as COVID-19. And because it is related to the smallpox, there are already treatments and vaccines on hand for curbing its spread. So although scientists are concerned because any new viral behavior is worrying, but they are not panicking, and we should all not panic, because we have to prepare ourselves. And as scientists are busy searching for cure, and one treatment is already not much available everywhere, but it is there. And the smallpox vaccination is itself 85% effective against the monkeypox. So we can expect in the near future, we will get a vaccine and we will get the treatment guidelines soon. So thank you so much.
Thank you, Dr. Hiba Sami.
Thank you, sir.
It was an excellent talk. We really enjoyed it.
Thank you, sir.
Is there a specific vaccine which is being made for monkeypox?
Yes, sir. Their vaccines are in different stages. Actually, the smallpox vaccine, which we were using earlier,
Yes.
was discontinued because the smallpox was eradicated in 1980. So
Okay.
there are currently there's a vaccine which is in trial that is, uses the modified virus of Ankara, and it is being used to develop the vaccine the monkeypox against the monkeypox.
This is very good news that the smallpox vaccine is effective against monkeypox. It's a very, very good thing. And another 15%, they can modify the vaccine.
So I want to make one comment.
Yes.
sir.
As the population in India, more than 45 years is vaccinated for smallpox. But younger, so means that we are protected. For example, I am protected. But for young generation, they have to take the vaccine against this
Smallpox.
monkey. Correct?
Correct, sir. And the elder generation, those who have taken the vaccine are protected. And if they get the disease, they will get a milder form of the disease, not a severe form.
And one more good news is people are recovering from monkeypox. You know, in Europe, there were 6,000 cases. No death was reported. So this is also good. It is very mild right now. But as you said, a virulent strain may come up suddenly. So we have to be prepared with the vaccine.
Yes.
Any more question by anybody?
Is there any center in Kolkata? That is a question.
Yes.
The question is in the chat box.
Is there any center of virology in Calcutta?
And Afreen ma'am has asked this question.
In Kolkata, there is a ICMR, National Institute of Cholera and Enteric Diseases, that
Yes.
has been given approval by ICMR to test this monkeypox.
Monkeypox, yes. And of course, in Pune, there is a center, National Institute of Virology,
Virology. Yes.
NIV. Yes. And Delhi also, there is a center.
AIMS.
AIMS. Any more question by anybody? So thank you, Hiba.
Thank you, sir.
We really enjoyed the talk.
Thank you so much.
Next, we have Dr. Miranda Datta from Assam, Jorhat. She was the CMO and MS in the civil hospital, Jorhat. Now she's working in the Jorhat Medical College. Dr. Miranda, over to you.
Hello, am I
Yes.
audible?
Yes.
Good afternoon,
Do you have
everyone.
any PPT? Do you have any PPT? Mirinda ma'am, whether you want to present PPT?
Hello.
Hello, Miranda.
Yes, yes.
Are you
Good
having
afternoon,
some?
everyone. Today we are discussing a very important topic, that is about monkeypox. We all know that the monkeypox is a very recent threat to human health, and it spread so quickly. But in India, we are getting only 8 cases till now. It may be transmitted from animal to human, and also human to human transmission. And animal to human transmission occurs through a bite and close contact with the infected animal, like the cat, monkey, squirrels, etc., apes, and rodents, etc. And human to human transmission occur through the respiratory droplets and of the patient, and the linens, clothes, and other articles used by the patient, and also from the secretion of the skin lesion of the patients. Already, Dr. Hiba has explained everything so nicely, but I am now going to focus the clinical presentation of the monkeypox disease. We all know that it is a viral zoonotic disease. The first 0 to 5 days period is called prodromal period, and the sign and symptoms in this prodromal period are fever, headache, body ache, enlargement of the lymph nodes, that is called lymphadenopathy. Then chills also. Most important aspect of the disease is skin manifestations. The skin manifestations usually occur within 2 to 3 days of the onset of fever, and it lasts for 2 to 4 weeks. The skin manifestations occurs as appearance of rashes. The rashes first appear in tongue.
I think she's having a internet problem.
Yeah, connectivity problem is with her.
Yeah, she has come.
Sorry. Then from face, it spreads to arm, palm, sole, and this thing leaks within 24 hours. Sometimes the genitals and conjunctiva of the eye may be affected also. The rashes have the rashes pass through 4 stages. These are called papular. First one is macular, papular, vesicular, and pustular. And it starts with a flat base, and on third day it progresses to papule. And by 3 to 4 days, the papule progresses to vesicle. The vesicle it has a very sharp edge, and it contains fluid. And by 6 to 7 days, it becomes pustule. Pustules have very sharp edge, and it contains pus. These are firm, discrete, deep-seated, well circumscribed, and umbilicate lesion. Sometimes, then what happens? And these rashes, the vesicles, they will within 2 weeks. I think within 2 weeks they dry up and crust, and the scabs remain for 1 week, almost 1 week before falling off. Then these rashes are at first the rashes are painful, but during healing stages they become very itchy. And sometimes what happens? Sometimes usually the skin lesions are multiple, but sometimes a very large area may be affected, and they scab and crust off, and they form a very large raw surface. Then usually it is a self-healing disease. But sometimes the disease may give rise to some complications like secondary infection, pneumonia, sepsis, encephalitis, and loss of vision due to involvement of the cornea of the eye. And mostly the face is affected. In 98% cases, face is affected. Then 95% sole and palm. Then 70% oral mucous membrane. Then 28% genitalia, and 20% conjunctiva. I think this is in a nutshell. I have explained the clinical presentation of the patient.
Very good. It is a very good presentation.
Thank
At
you.
least, we know what is happening in case of an infection of this virus.
Mm.
And there are some rashes on the skin also, some rashes.
Skin rashes, yes.
Okay,
Skin rashes are very most important aspect of the disease is skin rashes.
right.
They are
They're
four
very big.
phases.
They're very
Uh,
big
Like
rashes, right?
First is
I
very
think-
small. This macule is very small with a flat base. Then
Okay.
it will convert it to
I saw, yeah.
pupil.
I
Then
saw
it
some
will
very
be
big,
pustule.
very big pimple type
Like
of things.
Pimple
Are they
type
full of
thing.
pus? Are they having pus?
Yes. The pustule contains pus. That fourth stage. They
Yes.
contain pus. And opaque
Big.
fluid, that is pus.
Yeah. It's a very big one. Very big one.
Big one, yeah.
Yes.
Mm.
Very nice.
Umbilicated, very deep-seated, firm, umbilicated, well circumscribed lesion.
Right. Deshmukh sir, any question you want to ask?
No, it's all right because you see, as already ma'am has told, that is nothing to worry. Again, already some
Yes.
the previous ma'am has told, nothing to worry, nothing to be panic.
This is a self-limiting disease, but
But awareness is must.
awareness is must. Yes,
Correct.
patient
That-
must be kept. Isolation is the most important thing.
yes. And
Yeah.
today is our attempt to
Yeah.
create an awareness.
Yes.
And we
Thank
should
you,
also
ma'am.
put a mask, right?
Put a mask. The patient should also put a 3-layered mask.
Right. And
And,
the bed,
uh,
the bed
And
cloth,
hand
the bed
washing.
sheet.
Hand washing is very important. Hand washing is
Right.
very important.
Yes.
Hand washing with soap and water and sanitizer.
Right.
And sanitizer is very important.
Yes.
And the bed sheet of the infected person should be
Yes.
washed very nicely.
Very carefully with gloves and all.
Right.
The healthcare provider must be very take precaution.
Right. Any other question by anybody? Thank you very much, Dr. Miranda. It was a very,
Thank you
very
so
nice
much.
presentation. So next we have Dr. Akam Sushi from Nagaland. He's working in the Zion Hospital in Dimapur. Dr. Akam Sushi. Dr. Akam Sushi. Yes.
Good evening, everyone.
Please present.
I don't think he has left
Hmm.
because of some technical problem.
Should I telephone him once?
Can I share my slide, please?
Yes, please. Please make him co-host, Akam Sushi.
By which name he has joined, please?
Akam Sushi, A-K-U-M.
Welcome, AKUM.
Yes. Now he is co-host.
You can now present.
Thank you.
Dr. Akam will be speaking on prevention of monkeypox. Prevention.
Is there any problem in presentation?
No, he's starting the screen. Yes.
Okay, thank you.
Dr. Akam, your mic is off. Please on your mic. Dr. Akam? Dr. Akam?
I have given him message to unmute.
Yes, yes. Dr. Akam, please unmute your mic. Unmute your mic.
I think some problem is there with him.
Some problem, I think.
Yeah, because he has shared the slide.
Yes, yes.
but
Some internet
he is
problem.
He is not able to unmute himself. Although I'm trying,
Yes, yes.
but I can send only the message to him to unmute, please.
I will try to call him by telephone. 1 minute.
Correct.
I will try.
Yes, he is again admitted. Now he will be in position to unmute himself.
Hi, I'm sorry. My line got cut.
Yes,
My
sir.
line got cut. Am I?
Yeah, now we can hear you.
Okay. Thank you. I'll just share my screen. Can I be made the co-host again, please? Just sharing is disabled again.
Already your slide is there.
We can see your slide.
Oh, is it?
Yeah, but I can you another your mobile as a co-host.
You are a co-host now. Co-host. So
Yes,
you can do it.
you are co-host now. You can share again.
Yes.
Okay, I'll share.
Aku mai tu aku.
You are joined by the two devices, Akum sir. So
Yes, now we can see.
yeah, but you can exit from one device.
Yes. Please unmute your mic. Unmute. You have to unmute your mic. Your mic is off. Okay.
He has shared screen but not slides. Akum sir, again. Yes, Akum has started sharing screen.
Right, sir. Right, sir.
Akum sir has joined by two devices.
Yes.
Probably it is a problem. Two devices.
Let him open the screen, then we will tell.
Okay, okay, very good. So you can start now.
Akum, you can start now. But unmute your mic. Unmute your mic. I think he's having some difficulty, sir.
Yeah, he has unmuted. Hello, Akum, sir.
Yes, I have just unmuted, but when I share, it goes into the mute thing.
Actually, you have shared it,
When
but
I share the
again,
slides,
you are unshared.
yes, I just unshared because when I share the slides, I become muted. Unfortunately, I'll just leave once and enter once again for the last time.
Okay, okay, you try again. You try
Otherwise,
again.
you can speak.
So
Otherwise,
sorry.
you can speak.
Or you can speak. No
You
problem.
can
Without
speak
slide.
without slide also.
Okay.
No problem.
Okay, sure. Just the last try, and if I can't,
Okay.
then I'll just pick it out.
Okay. Okay.
So sorry for the glitch. So sorry.
No problem. No problem.
Huh? Come.
Now we have to let him in.
You can talk only, Akum, sir. Leave sharing, you can start.
I have sent him a message again to. I have invited him again.
He has left, I think.
Okay.
I have invited him.
I'm in now.
Okay. Okay.
I'll just share the slides. I think it should be okay now.
All right.
If I am allowed to share my slide, I'll share the slides.
Please share.
Please. Host, can you please enable my sharing, please?
Yeah, just 1 minute.
Sure.
Yes, now you are again closed.
Okay, thank you so much. Okay. I hope it's visible now.
Yes,
Yes,
sir.
please.
Yes.
Yes.
Okay.
Yes, proceed.
So sorry for the glitches. I'll just proceed with the slides. We will mention some points on preventing monkeypox. As we all know, we are still learning a lot on monkeypox, and there are things which we need to further discover. Basically, what we need now is to be careful. We need to make sure that the awareness is enough. The people get to know what it is, how it spreads, how to take care of oneself, and how to prevent this exposure, how to prevent the spreading of this virus. Unlike COVID times, we are now a little more aware about infectious disease, and probably will be better in handling conditions like monkeypox, etc. So basically, we have to avoid any materials such as beddings or any objects that a person or a sick person or a monkeypox patient it comes in contact with. isolate the infected patients from others. This is very, very important. Practice safe sex, including using of condoms. As we know, this is also transmitted sexually, as mentioned earlier. This is something we have to make sure it's done so that the spreading is under control. Now, apart from this, we have to continue with good hand hygiene, which we had practiced during COVID times. It's more than 2 to 3 years now that we have practiced good hand hygiene, wearing of mask, making sure we use alcohol-based hand sanitizers, and also to use proper PPE. I think we are very well versed with PPE at the moment, having COVID come, and now we have to make sure we continue with the use of PPE while caring for patients and people with monkeypox. Also, how to reduce the risk of human transmission. First of all, the surveillance has to be very good. If the surveillance is poor, then the identification of new cases and identification, even the persisting cases, will be very poor, and this will increase the number of outbreaks, and it will not be able to contain the outbreaks. And therefore, surveillance is one of the most important things to reduce the risk of human-to-human transmissions. During monkeypox outbreaks, the close contacts are very important, and these people have to be isolated, and these people need to be kept properly so that they do not spread to others just in case they have got it. Healthcare workers have to be very cautious, and house members or the household members of people who have the infection, or even those of health workers who are in contact with patients, are at greater risk, and they need to take adequate precaution so that the spread is further reduced. Make sure we implement the standard infection control precaution, which we already know a lot about, which we learned a lot in COVID times. The samples taken from people and animal with suspected cases of monkeypox should be handled with very utmost care. Make sure they are handled only by trained staff with suitable equipped lab, and making sure that the correct PPE is used by all. Make sure the patient specimen must be safely prepared and transported. As mentioned earlier, triple packaging should be used, as we all know, in accordance with the WHO guidance for transport of infectious substances. I think this has been mentioned quite extensively earlier. Infection prevention is another important thing, which is a combination of standard, contact, and droplet precaution, which should be applied in all healthcare settings when a patient comes with fever and any suspicion of monkeypox with vesicular or pustular rashes. Patient isolation, again, is utmost important. Patients should be managed in isolation using proper precaution. PPE dresses should be used. Precautions should also be taken to minimize exposure to the surrounding persons. The clothes and items of the patient should be discarded properly, which we all know.
I think there is some internet problem. Dr. Deshmukh?
Yes, sir. Yes. Again, it seems that there is some problem.
So anyway,
He has
we have
muted,
heard-
not problem. He has muted.
yeah, we have already heard. We have already
Okay.
heard about prevention. So
Yes.
if anybody has some question till now, we can answer. If
Or
there is
you
no
can
question-
proceed for the next.
Yes. No, next, I think he's not joined till now. His name is Dr. Alim Marak from Meghalaya. Dr. Alim, are you there? Dr. Alim Marak from Meghalaya, are you there? I think he has not joined, sir.
Okay, okay.
So I think we can conclude if there is no more question.
Yes, sir. Yes, yes.
I think there is no question, so we can conclude now. So it was a very informative session and we have learned a lot. It was a very nice
One
session.
minute. 1 minute. So we'll ask other Dr.
Dr. Alim,
is there, Dr. Chawla is there. Yeah. So Dr. Jian, Dr. Arundhati, please make any comment on the presentation up to the time. Swati Gupta is there. Anyone can make a comment? 3 presentations. Actually, we'll say 2.5 presentation. The last presentation was interrupted due to some reason. Yes, anyone want to make any comment? Bhagyashree Salunke is there. Chetan Shinde is there. Please.
Dr. Adil Raza is there. Dr. Adil, you want to give something?
Yes, Chawla. Chawla sir is unmuted, but
Dr. Bhagyashree Solanki. Dr. Bhagyashree Solanki, you want to give something, some comment?
No, sir.
All right. So if there is no comment, I think we can conclude now.
yes, yes, sir.
All right. It was a very informative session and we learned a lot how to deal with monkeypox. I hope it stays mild and does not trouble humanity. And efforts are going on to make a vaccine specifically against monkeypox. We have learned today that smallpox vaccine is 85% effective from Dr. Hiba. So that's very good news because most of our population is vaccinated for smallpox. Another 15% modification has to be there of the existing vaccine. So really, we have learned so many good things, how we can deal with monkeypox. I thank Dr. Deshmukh for giving us a platform to showcase a very important monkeypox, which is a threat to humanity. I thank Dr. Haris Khan, Dr. Hiba Sami, Dr. Miranda Datta, and Dr. Akam Tushi for telling us about prevention. The take-home message is we should not panic. We should be careful like we were in case of COVID. We should wear mask, 3-layered mask, and we should clean our hands with soap or with alcohol disinfectant. And the patient clothes and the bed sheet must be properly disinfected using very good detergent. So I thank all of you. Dr. Haris, I can see you. You initiated the discussion. It was very, very nice. Thank you so much.
Thank you so much. Thank you so much.
Thank you.
Thank you, sir. Thank you again for coming on the platform of Microbiologist Society. Just one of the participant, Professor Neha Patil, have made a comment in the chat box that this session was a very informative. Now someone has asked whether there is a feedback form. There is no feedback form. This is only for information. Thank you all speakers, and information will be circulated later on in all groups. Thank you, Swarnajit Singh. Thank you again.
Thank you, sir.